everyone, and welcome. Thank you for joining today's webinar on building COVID-19 vaccine confidence. Today's webinar is hosted by the Centers for Medicare and Medicaid Services Office of Minority Health, or CMS OMH. Next slide. A few reminders before we begin. You may ask questions or submit comments at any time via the chat box on your GoTo menu. If you are having audio issues, please dial in via the phone to number 1-562-247-8422 and use access code 895-380-069. These numbers are also listed on the screen. If you are encountering technical issues viewing the presentation, please try reopening the webinar in Google Chrome. Next slide. Today we will hear from Dr. LaShawn McKeever, Director of the CMS Office of Minority Health, Friday B, State and Jurisdiction Support Lead on the CDC COVID-19 Vaccine Confidence Team, and Dr. Peter Marks, Director of the FDA Center for Biologics Evaluation and Research. Next slide. Today, Dr. McKeever will begin with an overview of who we are at CMS OMH and what information we have available to you from our office and others at HHS. Next, Ms. Yee will share how the CDC Vaccine Confidence Team is supporting states and jurisdictions. Then, Dr. Marks will discuss the development of the COVID-19 vaccines to help us understand their safety. Finally, we'll address how to build confidence and offer some messaging for your outreach. At the end, we'll have a conversation with you all about what else may be needed, best practices you have found, or other thoughts you'd like to share with your colleagues and CMS. Next slide. I'll now pass it over to Dr. McKeever to begin.
Okay, thank you so much. So welcome everyone. As stated, my name is Dr. LaShawn McKeever. I'm the Director of the Office of Minority Health. As mentioned, I lead the CMS Office of Minority Health. It is one of 8 offices of minority health within HHS, and we're tasked with addressing the needs of specific populations. Our office is charged with ensuring that the voices and needs of underserved populations are present as CMS develops, implements, and evaluates our programs and policies. We envision a future where all of our beneficiaries achieve their highest level of health and where disparities in healthcare quality are eliminated. Given our role, we've focused on COVID-19 for the past year. We've been engaging with partners like you and developing resources for you as underserved populations are impacted and facing higher rates of infection and death rates. Today, I'm excited to share with you what we know about how we can help address vaccine hesitancy, particularly among our office's focused populations. We know that the best way to reach our populations is through you, our trusted partners. So we hope this webinar gives you the tools, resources, and language to help you as you address the needs of your target populations. Next slide, please. I'm experiencing a little technical difficulties on this end. So we're going to get started first on talking about building vaccine confidence through information sharing. I want to begin by going over some of the resources from CMS and the CMS Office of Minority Health specifically that we hope will be useful tools for you to draw upon as you engage with your respective communities. CMS OMH has 2 web pages of COVID-19 resources, including a page of vaccine-specific resources. We have lists of resources for healthcare professionals, consumers and patients, non-English speakers, partners who are educating COVID-19 vaccine recipients, long-term care facilities, and health plans and programs. Next slide, please. Here are two resources that we recently released under our From Coverage to Care initiative that talk about the COVID-19 pandemic and key highlights from key information from the CDC, HHS, and CMS. The first one I'll mention is Coronavirus in Your Health Coverage. Get the basics. This piece discusses how to protect yourself and your family during COVID-19 with tips on staying healthy during this time. The second one is called Stay Safe, Getting the Care You Need at Home. This offers tips for how to stay healthy during COVID-19 with information about scheduling health appointments from home and planning ahead for prescriptions. We also talk a little about telehealth. Both resources can be found on our website at go.cms.gov/C2C COVID-19. Next slide, please. Given the increased use of telehealth during the pandemic, we created resources that compile key information on telehealth in one place. So we released two new C2C resource toolkits, one aimed at patients and another at providers. With our patient-facing toolkit called Telehealth, What to Know for Your Family, patients can learn about the types of care they receive through telehealth, how to prepare for an appointment, and what to expect during a visit, and more. This resource is also available in Spanish. With our provider-facing toolkit called Telehealth and Providers, What You Need to Know, providers can learn how and when to use telehealth. Topics include how to set up telehealth services, how to conduct a successful visit, and how to keep up to date on telehealth payment, with specific information for Medicare and Medicaid. Next slide. I'll also mention the Rural Crosswalk, CMS Flexibilities to Fight COVID-19 resource. This crosswalk highlights COVID-19 related provisions that CMS has issued by regulation or waiver that impacts various rural providers, including rural health clinics, federally qualified health centers, critical access hospitals, rural acute care PPS hospitals, and skilled nursing facilities. Next slide. In addition, I wanted to mention some recent funding opportunities related to COVID-19. CDC announced the availability of funds to achieve the goals of the CARES Act in the protecting the American people from the public health impacts of COVID-19. This 3-year opportunity provides funds to conduct national evaluation of the community health workers for COVID response in resilient communities, and provides training and technical assistance to the CCR recipients. Applicants can apply to either component of the program, and applications are due on May 24th, 2020, so there is still time to apply. There are several other funding opportunities that are now closed, and a few are listed on the slide here, so continue to listen for more of those opportunities. Next slide. Next, I'll touch on the COVID-19 Community Course Program, a program launched by HHS, where trusted voices in communities across the country will regularly receive updated public health information, resources, and assets to share with their communities to help get their friends, families, and followers vaccinated. Members of the Community Core program will receive CDC-approved materials like toolkits, FAQs, and social graphics to help them deliver fact-based information to their networks. Some of the 250 plus members include the American Medical Association, the NAACP, UNIDOS, the Chambers of Commerce, and Catholic Charities. Collectively, the group of founding members has the ability to reach millions of people and deliver critical public health information. You'll see more on social media and TV ads, but you can go to hhs.gov/COVID Community Course to get resources on toolkits and to become a part of this effort. Next slide. One of the resources HHS provides is a presentation with vaccine facts and FAQs for Latino audiences, available in both English and Spanish. The presentation covers topics such as building vaccine confidence, preventive measures, and vaccine safety and efficacy. Next slide. The resource section on the HHS website includes a number of toolkits, including one for older adults, which now reflects updates regarding the J&J vaccine and the latest on masking and information about being fully vaccinated and more. Each toolkit can be downloaded as a single PDF, and assets can be downloaded individually. The HHS Immunity in Our Community podcast is also a great resource as it features various subject matter experts, including Dr. Fossey and Dr. Marcella Nunes-Smith. And their partner sites feature a COVID-19 vaccine hesitancy in your community map to see where people may be hesitant about getting vaccinated. Next slide. In addition, let others know you can use vaccines.gov to find a vaccination location near you, then call or visit their website to make an appointment. Next slide. I encourage you all to explore CDC's Vaccinate with Confidence web pages. Here you'll find tips on how to encourage confidence. Resources are also available from community partners, including tip sheets, guides, checklists, conversation starters, and more. There is a lot of information there, so I encourage you to spend some time going through this site to look for resources specific to the needs of your community. There is even a map of data tracking vaccine hesitancy at the county level. Next slide. In addition, the CDC has a list of 6 ways to help build vaccine confidence. We'll dive into this more later in the presentation, but this is a great summary here on steps that you can take to increase vaccine confidence in your communities. The CDC recommends a few steps here. Encourage leaders in your community, family, or organizations to be vaccine champions. Have discussions with your family and friends about vaccination to understand their perspective and encourage their decisions to vaccinate. Share key messages through multiple channels that people trust and that promote action. Help educate people about COVID-19 vaccines, how they are developed and monitored for safety, and how individuals can talk to others about the vaccines. Learn more about finding credible vaccine information where you come across COVID-19 information, cross-check when you come across COVID-19 information, cross-check with cdc.gov and learn how to respond to misinformation you may encounter. And when the vaccine is offered to you, make visible your decision to get vaccinated and celebrate it. Now I'll turn back to the moderator. My apologies for those technical difficulties at the onstart, but I look forward to the conversation ahead. Thank you.
Thank you. And next slide. We'll now pass it over to Daiva Yi to talk about how the Vaccine Confidence Team is supporting states and jurisdictions.
Great, thank you so much. And Dr. McIver talked a little bit about some of the ways in which CDC is working to support states and jurisdictions, but I just wanted to share one slide just really quickly about some of the ways that our team, the Vaccine Confidence Team, is supporting states. So we have kind of a number of ways in which we support. One is this direct support kind of piece of the pie here. And one of the things that we do is helping to coordinate these confidence consults, which are basically conversations between states and jurisdictions and subject matter experts on our team to provide technical assistance in assessing, diagnosing, and addressing vaccine confidence challenges in specific target communities. And we have experts in a variety of fields who can provide insight from addressing misinformation to working with faith-based organizations to increasing vaccine confidence among healthcare personnel. So anyone who's interested in scheduling a vaccine consult can email us at confidenceconsult@cdc.gov, and I'll put that in the chat so everyone can see it as well. We've also held a couple of deployments to specific places that we're seeing challenges with their communities in vaccine uptake. We also have partnerships. And then over here on the guidance part, we have a couple of things as well. So the vaccine communication toolkits, which are also available online on our website, which target specific communities. We also have a rapid community assessment guide, which is really meant to be a rapid, low-touch way to gather information on our target community's vaccine confidence. And so on our website, you can find the toolkits that are available, and they include guidance for collecting information in a number of ways, qualitative and quantitative, such as listening sessions, key informant interviews, or social listening. And we've assisted with these in a few areas, and the findings have been used to develop a plan to address vaccine confidence challenges. So it's a really great way to kind of understand what's going on in the community. We also have vaccine confidence boot camps, which are essentially 2-hour crash courses on vaccine confidence for state or territorial immunization programs and partners. And in this 2-hour session, we provide an overview of vaccine confidence concepts and best practices for building vaccine confidence in communities. And then finally, here in our last section, we have our behavioral insights unit, and they help to develop the State of Vaccine Confidence Insights report. And this is a report that we develop bi-weekly, in which they compile qualitative and quantitative data that's been gathered from a variety of sources, and they identify common and emerging themes influencing confidence and uptake on the COVID-19 vaccine. And so we distribute this bi-weekly, as I said, and if you're interested in receiving the report, I'll put an email address in the chat where you can email to be added to that distribution list. So that's all I've got. Just wanted to share a little bit about what we're doing to support states and jurisdictions. You're welcome to reach out to us in the emails that I'll put on the chat, and thank you so much.
Thank you, Diva. We'll now pass it over to our FDA speaker, Dr. Peter Marks, to help us understand the development of the COVID-19 vaccines. And we can move to the next slide.
Thanks very much for having me. So I'll tell you a bit about the development of the COVID-19 vaccines, trying to provide some information that will hopefully help people have confidence to use these vaccines. And let's see if I can have the next slide. Traditionally, vaccine development is a very orderly process that usually takes several years, and it moves from one stage to the other with a lot of evaluation of whether at each step of the way it's working. It can take several years for a product to get through the clinical trials needed to get it to licensure, and usually nobody actually starts manufacturing it in large amounts until the very end, till one actually knows that one has a vaccine that works. Can I have the next slide? On the other hand, when you have a pandemic like we've had with COVID-19, one can do things to speed this process up without cutting any corners and end up at pretty much the same place of doing what takes several years and getting it done in a year or less. And that's actually what was done for the COVID-19 vaccines. What one does is one collapses the different phases of clinical trials that we usually use into essentially one phase, and at the same time, one scales up the manufacturing necessary to be able to make the vaccines at risk while one is doing those clinical trials. That's basically that combination of things which was done allows one then, when one sees that a vaccine is effective, one has product ready to be able to deploy. And that's what has been done for the COVID-19 vaccines. The efficacy that's been studied for these vaccines is very much like the efficacy data that we have for other licensed vaccines. And it's the safety data that's a little bit shorter, but which we're looking at on an ongoing basis. And I'll tell you a bit more about that. If I can have the next slide. What we've done when we design these trials is we set kind of goals for the manufacturing and for the clinical outcomes. And for the clinical outcomes, we said that there had to be at least 50% efficacy of these vaccines so that it would make it worthwhile for people to take them. Indeed, that's something that you'll see the various manufacturers have met. We also noted that you would need at least a median of 2 months of safety follow-up when we considered these vaccines for broad use. And the reason for that is because most adverse events with vaccines show up within the first 6 weeks of administration, and 8 weeks is giving a little margin there. Now, obviously, we're doing longer safety surveillance on these vaccines, but this was at least to get them out there. For the next slide, please. Normally, when we issue a vaccine, it's through something called a biologics license. And our licensed vaccines mean that the products are safe, pure, and potent, and that there's substantial evidence of efficacy from adequate and well-controlled trials. In other words, that's our gold standard. If you have the next slide. The Emergency Use Authorization Authority was put in place after the terrorist attacks of 9/11 to allow us to take medical products that could help people with diseases that were not addressed, for which there was no available or approved alternative product, to be able to potentially get help from a medical product that was in development. And so the standard here for emergency use authorization, which is what we can do as a pathway at FDA to make products that are investigational available broadly, is that the product may be effective and its known and potential benefits outweigh the known and potential risks. Now, if hearing that makes you think, well, I want my vaccine to be more effective than just maybe effective, we share that. And if I can have the next slide, that's why when we put out guidance, we made very clear that for a COVID-19 vaccine, it was going to look much more like a licensed vaccine. Might not be licensed, but it was going to have the same kind of clear and compelling efficacy demonstrated in large, well-designed phase 3 clinical trials. And as I'll show you, the clinical trial programs for these COVID-19 vaccines were very similar in size to those for licensed vaccines. We also would have very careful evaluation of the quality, safety, and efficacy of these vaccines. We would do a public process, have a public advisory committee meeting, post the documents that supported use of the vaccine, and we've followed through with that. And after these vaccines were put into use, we would make sure that we were keeping track of any adverse events, and we're doing all of that. If in the next slide. So just to take you through, there are several advanced candidates that are still in development, but the three that I want to mention today are the three products that are available under emergency use authorization, the 2 mRNA-based vaccines, the Pfizer BioNTech and the Moderna vaccines, and a non-replicating viral vector vaccine, the Janssen or Johnson & Johnson vaccine. All of these showed excellent efficacy in preventing deaths and hospitalization from COVID-19. And just to give you an idea of some of the information that supports their use, and go to the next slide, I can tell you that these vaccines were studied in very large trials, 30,000 to 43,000 or more patients in the trials. They were randomized trials, so for each person that got the vaccine, one person got a placebo, that is just some saline instead of the active vaccine, and so we can compare whether the vaccine worked or not. And the people enrolled in these trials really were a cross-section of the people in our country. Maybe not perfect, but pretty reasonable enrollment that was actively sought for various underserved minorities, Black population about 10% in the mRNA vaccine trials, a little higher in the Janssen trial, Hispanic or Latino population, 20-25% in the mRNA trials, vaccine trials, and 45% in the Janssen trial. In part, that was because that trial was also conducted in South America, and about 20-25% of the people over age 65. So a reasonably diverse population. Additionally, about 30 to 40% of the people in these trials had medical conditions that put them at higher risk for complications of COVID-19, things like diabetes, high blood pressure. Next slide, please. So very quickly, just to say, the vaccine efficacy for these vaccines was excellent, and although there are some modest differences with the 2-dose regimens Pfizer and Moderna in terms of less severe forms of COVID-19. The single-dose Janssen vaccine, all of them, that they have extremely good efficacy against hospitalization and death from COVID-19, essentially preventing 100% of deaths from COVID-19. So the bottom line is Janssen has the benefit of being a little more convenient, single dose. The Pfizer Moderna may be a little bit more effective against the less severe forms of COVID-19, but the top line messages here is all of these vaccines do what most people care most about, which is prevent death or hospitalization from COVID-19. If I can have the next slide. The safety of these vaccines obviously is something we look very carefully at, and it's important to understand that the safety events with these are mostly mild and they're short lasting, but there are some that occur pretty commonly, and people should be warned about these because it's nothing out of the ordinary. There's oftentimes discomfort at the site of injection. That's reported with any of these vaccines, a little bit more with the mRNA Pfizer and Moderna vaccines than with Janssen. And then there are flu-like symptoms, including feeling tired, and that's probably the most significant thing after the second dose of the mRNA vaccines. And so generally we advise people that after the second dose of their mRNA vaccines, they may want to make sure that the day after they are not overscheduled or planning anything too strenuous. Then the next slide, please. We're lucky enough that just earlier this week, we had an expansion of the emergency use authorization for the Pfizer vaccine to include children or adolescents ages 12 through 15. And so that trial involved about 2,200 plus adolescents. Again, a diverse group of children enrolled, perhaps not quite as diverse as the adults, but again, reasonably so. I think the next slide, please. Importantly, this vaccine had very nice efficacy in preventing COVID-19 in 12 to 15-year-olds and essentially prevented all cases of symptomatic COVID-19. So no cases in those who were vaccinated versus 16 in those who were not. So that's about 1,000 who were vaccinated versus close to 1,000 who were not. So very nice to see this type of efficacy. And if I have the next slide, the important thing also was that the side effect profile in adolescents ages 12 to 15 was very similar to the side effect profile in the older individuals, such as the 16 to 25-year-olds. So if anything, these vaccines are working just as well and seem to be just as safe in the 12 to 15-year-old population, which is to us exciting because it would be nice to be able to see junior high school and high school students get back to school in the fall. The next slide, please. Obviously, as we move forward, we'll continue to monitor the safety of these vaccines very carefully because safety is something that's tremendously important. As safety concerns come up, we'll keep people advised of them. And I'll stop there.
Thank you, Dr. Marks. And next slide. We'll now return to Dr. McGeever with CMS OMH.
Thank you, and thank you, Dr. Marks, for that important overview. We'll now turn our conversation to building vaccine confidence. We all hear about vaccine hesitancy, but we want to encourage positive, action-oriented thinking, so we use the term confidence. But we know it's not as simple as confidence. There are also issues of distribution, access, transportation, waiting, and a host of things that each community is experiencing uniquely. What we hope to do in this section is give you the language and messaging to build the confidence portion of your vaccine outreach. Next slide. First, we always take the opportunity to remind people that whether vaccinated or not, we must take our own action to protect ourselves, our families, and our community. We must use every available tool, which still includes vaccines, masks, social distancing, and hand washing. We can't let our guard down, so these reminders are always useful. Next slide. Next, the CDC has listed key things to know about COVID vaccines, and this is a very helpful summary, which we talked briefly about earlier. You'll see the key items listed here and on the CDC website, link at the bottom. You can use this information in your messaging when speaking with people about vaccines, including those who may be experiencing some vaccine hesitancy. While you may need to tailor the message for different populations, these key points given by the right person address many of the general hesitancies people have. Let them know that COVID-19 vaccines are safe and effective, and Dr. Marks outlined that in his presentation. They may have side effects after vaccination, but they are normal. These are normal. It typically takes 2 weeks after vaccination for the body to build protection or immunity against the virus that causes COVID-19. You are not fully vaccinated until 2 weeks after the second dose of a 2-dose vaccine or 2 weeks after a 1-dose vaccine. COVID-19 vaccines are now more widely accessible. And as noted, the Pfizer vaccine for 12 years and older are, as the recent decision on that. But folks are now eligible for a COVID vaccine. So essentially everyone over the age of 12. And people who have been fully vaccinated can start to begin to do some of those things that they had stopped doing because of the pandemic. Next slide. In addition to understanding facts about the vaccine, it is important to note cost, and that cost should not be a barrier to anyone, but understanding that it is important. So regardless of one's insurance, or even if they are uninsured or undocumented, there is no cost for the vaccine. People may be asked for their insurance card if they have one, so their insurance can be billed, but no consumer should have any costs. In Medicare, this means that no beneficiary should pay a copay deductible for a COVID vaccine. And we want to be clear, beneficiaries should take their red, white, and blue Medicare card with them so their insurance can be billed, just like with any other services. We also heard that some places are charging fees, and this should not happen. There should be no money exchanged. For Medicaid patients, states will pay for vaccine administration without copays. Additionally, insurers at most group and individual health insurance plan coverage must cover the COVID vaccine in or out of network during the public health emergency. And for people who are undocumented, they are also able to get vaccinated at no cost. A person does not have to show an ID, although they may be asked. And if a person provides their ID or information, it cannot be used for other purposes. Next slide. These are some additional links for more information about the no cost aspects of the vaccine. Next slide. CMS also wants to make sure that our Medicare beneficiaries are on alert for scammers trying to steal their Medicare number. Medicare covers the vaccine, as I said, at no cost to our beneficiaries. So if anyone asks a Medicare beneficiary for their number to get early access to the vaccine, it is a scam. And here's what you should know. So you can't pay to put your name on a vaccine list, and we've heard of these instances. You can't pay to get early access to the vaccine. And again, we're encouraging that people not share their personal or financial information if someone calls or texts or emails promising that they'll get access to the vaccine for free. Next slide. If you did pay a fee or get a bill for a COVID-19 vaccine, what we would like people to know is that they should check their receipts and statements that they get from their provider for any mistakes. They should call their provider's office to ask about any changes that they think are incorrect. And the person if the person you speak to may help you better understand the services you got or realize they made a billing error. If you have original Medicare, review your Medicare summary notice for errors and report anything suspicious to Medicare by calling 1-800-MEDICARE. If you have other coverage like Medicare Advantage plan, like a Medicare Advantage plan, review your explanation of benefits and report anything suspicious to your insurer. And if you think your provider incorrectly charged you for the COVID-19 vaccine, ask for a refund. Also, if you think your provider charged for an office visit or other fee, but the only service you received was a COVID-19 vaccine, we're encouraging people to report them to the HHS Office of the Inspector General by calling 1-800-HHS-TIPS or by visiting tips.hhs.gov. Next slide. We discussed earlier that we prefer the term confidence to hesitancy, but it's important to understand what we are discussing and what many are experiencing. Vaccine hesitancy is the delay or refusal of the vaccine despite their availability. It's generally based on beliefs about risk, personal choice, and mistrust, which can vary based on race, age, geography, and a number of other factors. On the other side, some people are taking a wait-and-see approach to increase their comfort level that the vaccine is safe and effective. Next slide. Vaccine confidence is the trust that parents, patients, or providers have in recommended vaccines, in the providers who administer the vaccines, and in the process and policies that led to vaccine development, licensure, manufacturing, and recommendations for use. Confidence in vaccines, the vaccinator, and the system all support people's decision to get vaccinated. And strong confidence in the vaccines within communities lead to more people getting vaccinated, which leads to fewer COVID-19 illnesses, hospitalizations, and deaths. Next slide. While there are differences among various populations and why they may be hesitant to get a COVID-19 vaccine, there are some common strategies for overcoming vaccine hesitancy. First, trust in public health messengers across all communities, such as trusted medical professionals. One-on-one conversations with a trusted healthcare giver is one of the most effective ways to overcome vaccine hesitancy. Other messengers include a local public health department and government agencies like the CDC and the FDA. You can also seek out peers who have had positive experiences with the vaccine to encourage peer-to-peer messaging. Receive vaccine information from other trusted or influential sources can also help people overcome vaccine hesitancy, so consider targeting specific populations through media and social media campaigns. Also be sure to offer resources in accessible languages so that the information is widely available. Next, remove functional barriers wherever possible, letting people know when, how, and where they can get their vaccine may make it easier to convince them to do so. Reinforcing the message that no one should have to pay to receive a COVID-19 vaccine, even if you don't have health insurance, may overcome concerns about its cost and may also help people avoid potential COVID-19 vaccine scams. Finally, provide and promote accurate information and messaging. Accurate information is available to people who seek it out on the CMS, CDC, and FDA websites, so we encourage you to visit them today. Next slide. According to the Kaiser Family Foundation, individual healthcare providers are the most trusted messengers when it comes to information about the COVID-19 vaccine, or the COVID-19 vaccines. In the messages they've tested, emphasizing the effectiveness of the vaccine at preventing serious illness and death is most effective across groups. 2/3 of those in the wait and see group and four out of 10 in the only if required group say they'd be more likely to get vaccinated after hearing vaccines are nearly 100% effective at preventing hospitalizations and death from COVID-19. The wait and see group is an important target for outreach and messaging since they express some concerns about getting vaccinated, but will likely be much easier to convert from vaccine hesitant to vaccine acceptant than those who say they will definitely not get the vaccine or will only get it if required to do so. Other messages and information that are effective at persuading many in the wait and see group include that scientists have been working on the technology used in the new COVID-19 vaccine for 20 years, and that was noted previously. More than 100,000 people from diverse backgrounds took part in the vaccine trials. The vast majority of doctors who have been offered the vaccine have taken it, and there is no cost to get the vaccine. Next slide. One of the effective ways to convince someone to get the vaccine is looking at the side effects of the vaccine versus the severity of the actual disease if a person is unvaccinated. Many people have no side effects or may just have a sore arm at the site of injection. But some side effects could include pain and swelling on the arm where they receive their shot, fever, chills, fatigue, or headache. And common side effects of the COVID-19 vaccine are normal and resolve usually within 1 to 2 days of getting the vaccine. Next slide. Some individuals may be hesitant about receiving the Johnson & Johnson vaccine in particular after a pause was recommended when 6 cases of rare and severe blood clots were reported following administration of the vaccine. However, following a thorough safety review, the FDA and CDC have determined that the use of the Johnson & Johnson COVID vaccine should be resumed within the US, and they have confidence that this vaccine is safe and effective in preventing COVID-19. The FDA has determined that the available data shows the vaccine's known and potential benefits outweigh its known and potential risks in individuals 18 years and older. Healthcare providers administering the vaccine and vaccine recipients or caregivers should review the fact sheets linked on the slide and sent in the chat, which have been revised to include information about the risks of TTS. Next slide. So on one hand, there are some common side effects, while many have no side effects at all. But the risk of COVID infection, hospitalization, and death are very real and highly documented. You'll see here a summary chart by race and ethnicity, where, for example, African Americans and Hispanics are roughly 3 times as likely to get hospitalized from COVID-19, and many groups are twice as likely or higher to die. This serious risk can be helpful to explain the importance of vaccination. Therefore, as you can see, it is extremely important for groups like African Americans and Hispanics in particular that they're vaccinated. Next slide, please. Some studies have been completed to understand the best and most effective message for consumers to get them to take the vaccine, and we've talked a little bit about that. For some, that may be addressing safety, science, or likening the vaccine to many childhood vaccines we all receive that are widely accepted as safe and effective. The Kaiser Foundation found that those who have not yet been vaccinated would more likely get a vaccine if they heard it is highly effective in preventing illness from COVID, and that was previously mentioned. In addition, that they would be less likely to get the vaccine if they heard some people have gotten severe allergic reactions or experienced short-term side effects such as pain or fever. And so again, these are some of the messaging tactics that we're finding are resonating within different groups or not. Next slide. We do know there are changing opinions on getting vaccinated. According to a survey from the Pew Research Center, 69% of the public had already gotten or intended to get a vaccine in February, up significantly from 60% who said they planned to get vaccinated in November. Next slide. Similarly, the Kaiser Family Foundation found that vaccine enthusiasm has increased as more people have seen their families and friends get vaccinated. Next slide. This slide outlines CMS's campaign strategy for people with Medicare. You may have already seen these ads, but the work includes paid media to help the pent-up demand to be met, promoting the movable middle, the generally 33% who say, "I'll wait to get my vaccine," leveraging the Medicare voice. Remember, the main campaign is coming from HHS, but we know our seniors trust Medicare, so we hope this echoes and complements the main campaign HHS is leading as well. The work will target hesitant and negatively impacted audiences, and according to the CDC tracker, deaths per 100,000 are higher among African Americans and Latinos compared to whites, and that was noted as well earlier. Next slide. The CMS Office of Communication tested messages with our Medicare beneficiaries who are hesitant about getting the vaccine. And in general, skepticism in the effectiveness of the vaccine was the main reason for hesitancy. But messaging pointing to the vaccine effectiveness isn't as compelling to every audience. So of the 7 messages that were tested, 3 garnered the most positive reactions for promoting protection of self and loved ones and emphasizing getting back to normal life. So the top 3 messages were, "I will get the vaccine to help protect the people I love, myself, and others around me." So protecting loved ones and helping to slow the spread of infections resonated with our focus within our focus groups. Getting an appointment, or so number 2, getting an appointment for the vaccine will be a hassle, but it's worth it, so I can get back to my normal life. This reflects what they cautiously hope for, a return to normal, but some are not convinced this will happen even with the vaccine. Getting COVID can be deadly. Thousands of Americans have died from COVID. Get the COVID vaccine to protect yourself and others. This message here is a compelling concept if the vaccine really is effective in providing protection against COVID. So these are some of the messages that resonated and things that we learned from our focus groups. And just to note here, some of the things that are less compelling and that you may want to consider as you're thinking about building vaccine confidence in your target populations include things that suggest that the odds are better with the vaccine than getting COVID, a message that the vaccine limits the likelihood that you will get COVID. This can be seen as proof that it may not be effective. Messages that focus on the idea that the vaccine is safe and effective because they do not believe this. The idea that vaccine side effects are worth the protection because they are concerned with the potential for adverse events due to the vaccine. So as you can see, there are some messages that we have found are resonating, but then there are others that are less compelling. And so hopefully there are some lessons that you all can take away from that as well. Next slide. In addition, CMS tactics for increasing vaccine competence and uptake have included email blasts, the Medicare.gov COVID page, social media content, and outreach to partners such as what we're doing today. Just this week, new tactics included paid advertising to reach target audiences, earned media efforts to promote the vaccine, and using the customer voice as often as possible, and using partners to reach local populations. Next slide. Here's an ad that started running May 10th and promotes several of the key messages that we've discussed in this presentation. Next slide. So I hope this part of the presentation included some useful information that you can use today as you work to build vaccine confidence in your respective communities. I'll now turn it over to our moderator to introduce the discussion portion of the webinar. Thank you all so much.
Thank you, Dr. McGeever. We've reached the end of the presentation portion. We'll now begin with some questions from the chat box. Please continue to send us your questions or other ideas or best practices you may have experienced that you'd like to share with others on the line. One participant said that they received lots of questions from minority patients about the vaccine affecting fertility and changes in their cycle. Could you please address?
I'm going to ask my colleagues from the FDA and CDC to join me for the discussion. There you are. Dr. Marks, do you want to take that question?
Yeah, I'm very happy to. This is a very common concern that's come up, in part because of some misinformation that has been spread in the past. These vaccines, first of all, the mRNA vaccines and the non-viral vector, the adenoviral vector vaccine, all of the authorized vaccines do not affect fertility. They just don't. The mRNA vaccines, there was this rumor started that it had some likeness to something involved in reproduction, but it doesn't. And so there's no concerns. And in fact, the data, there actually is scientific information that shows that they were studied in very thorough studies in what we have as thorough reproductive studies and developmental studies, and there's no evidence for that for either of the mRNA vaccines. There's none of that either for the Janssen vaccine as well. Whether there could be some menstrual cycle irregularities after getting the vaccine, it's possible. And that's because some people do get some of these symptoms that are flu-like afterwards, but that should resolve pretty shortly after that. And maybe my CDC colleague wants to amplify it all.
No, that was great. And actually, I just wanted to point out that we do have some talking points on our CDC website. There's a website called Myths and Facts about the COVID vaccine, and that is covered on there. So if you just need some talking points or a place to look, that's where to find it.
Thank you all. Another participant said they just read an article that said the barrier wasn't so much vaccine hesitancy, but access to vaccination. Are we spending too much effort to address hesitancy?
So I'll take a shot at that. I didn't, no pun intended, but I'll try to address that. I think it's still an important part of the conversation. And, you know, what I've seen over time is that we're collectively trying to address many of the barriers, you know, that we're facing to get as many people vaccinated as soon as we can. But the hesitancy piece is still an important part of the conversation because for some populations, you know, this is very real. Their experiences that have led to this place where they're hesitant to get vaccinated. These are very real experiences, and I've had the opportunity to talk to people across the country, and everyone's in different places with it. So I think there's conversations of access. They are happening and they are important. And I mentioned earlier in the presentation that we realize that this is one part of the equation, but I know, for example, in some communities, they still are struggling to set up sites to do this and to coordinate within, you know, to coordinate their local resources to get people out. There's still, many communities are in different places with planning and execution and in ensuring access. I talked about there's no cost. So usually there's a barrier of cost, but there's no cost, but there are other barriers that we have to overcome. So I think it's not an either or, but it is an and. These are things that are still important to help us get as many people vaccinated as possible.
Thank you, Dr. McGeever. We have a couple questions for Dr. Marks. What was the vaccine demographic breakdown of women versus men? And was disability data collected in vaccine trials as a demographic variable?
Yeah, so the breakdown for most of these trials was close to 50-50 men and women. The different trials, it might have been a little bit different, but it's roughly the same. And I don't have data on we have data on medical comorbidities, but not on physical disabilities that I can quote to you on these.
Thank you, Dr. Marks. Our next question is, what do you say to people that say, if I still have to wear a mask and socially distance myself, why should I get a vaccine? Why should I be confident in a vaccine when the CDC is not confident in loosening up the COVID-19 restrictions?
So I'm happy to start with that one, and then someone can answer a little further. In fact, the CDC is loosening the vaccine, when the guidance for masks when people are vaccinated, in terms of who you can have over to your house, what you might do outside. But really, the reason to get vaccinated is twofold. First of all, for yourself, because you do not want COVID-19. Even if you don't think you're going to die from it, you don't want to have long hauler syndrome. About 1 in 4 to 1 in 3 people who get COVID-19 have all sorts of issues afterwards, and they can range from this brain fogginess, which is basically an inability to concentrate, to problems with the heart, to problems with breathing over the long term. So one just would like to avoid that at all. This isn't just a passing cold. This is something that can leave you with some long-term side effects. The other reason to do it is for all of those around you, because you don't want to be spreading this thing around. Because again, even though you might say, well, 14, 15-year-olds, they don't get very severe COVID-19 most of the time. Yes, but if they go to visit their grandparents, they will potentially bring their grandparents. They may not even feel like they have COVID-19. They may not know it. But if they bring it to their grandparents and their grandparents are not vaccinated, that could be a life-ending event. So there are reasons to do this for yourself and for your communities. And the CDC is adapting by changing guidance. It's one of these things that I'm the first to acknowledge that sometimes it doesn't seem like it changes fast enough. That's just how it works, but it is evolving such that, now you can have people, you can have some unvaccinated, one other unvaccinated group of people that's a family unit or a unit over to your house if you're all vaccinated. There are things, and I may not even be up with the latest CDC guidance. They keep moving that forward.
Dr. Marks, thank you all for your questions and comments. We'll move to the next slide, and I'll pass it back to Dr. McGeever to conclude the webinar.
So I wanted to just say thank you to the presenters today, and thank you to everyone that's joined us for our webinar. If you'd like to get in touch with us, please send an email to omh@cms.hhs.gov. We've also listed links on the slide to some of our key COVID-19 vaccine pages. And as a reminder, a recording, transcript, and the slide deck from today's presentation will be posted to the CMS OMH All Webinars and Events page in the coming weeks. So in the meantime, please feel free to review the supplemental handout and the CDC fact sheet currently listed on the page here. We will share the link to the page in the chat now. And thank you again for your time and participation. We hope this was helpful. Have a wonderful day.